Dr. Molly here. I'm a professor at the College of Health Professions at University of Detroit Mercy, and I'm one of the co-founders of Associates in Primary Care. One of the things we are trying to do at Associates in Primary Care is improve patient education and patient knowledge because we believe if patients understand their health care, they're going to be better able to manage that health care. So, in this series, we're going to talk about type 2 diabetes. We'll also talk a little bit about prediabetes. We are not going to talk about type 1 diabetes or gestational diabetes. These kinds of diabetes are very different from each other. A lot of times when we are talking about diabetes, lay people sometimes think that type 1 and type 2 diabetes are similar. They are not. The only thing those two disease processes share in common is that they are both diseases of the pancreas. Type 1 diabetics, their pancreas doesn't produce insulin at all, and they always have to be on insulin in order to treat that disease. That's not the case with type 2 diabetes. In type 2 diabetes, the pancreas does produce insulin, but that insulin it just becomes less and less effective depending on the severity and how long the patient has had this disease. Gestational diabetes occurs in women, some women who are pregnant, and that can be a risk factor for type 2 diabetes later in life. But we're going to focus predominantly on type 2 diabetes. The reason we're going to focus on that is because it is a very, very prevalent chronic condition in the United States. Nearly 38 million people in the United States have type 2 diabetes. That's about 1 in 10 people. This is a very complicated topic. I'm going to break this down in several small bite-sized pieces because unless you're in medical training, you probably don't want to sit through a 3-hour diabetic lecture. And even if you're one of my students, you still don't want to sit through the lecture. You just want to know what's on the exam. So I'm going to try to hit those highlights and get you the important parts that are going to be on the exam. Not that you're having an exam. This first topic is an overview of what type 2 diabetes is. We're going to also do some series on what are the risk factors, what are the treatment options, how do you know if you've got type 2 diabetes, things like that. So it'll be a series. So you can just look through the topic headings and find the specific content within diabetes that is of interest to you. The last one, I'm going to list quite a few resources. There are a ton of resources available for people that have type 2 diabetes. In type 2 diabetes, the pancreas produces insulin when we eat. Insulin picks up glucose. So the food that we eat, especially the carbohydrates and the sugars and the sweets, convert to glucose. We need glucose. It's like the fuel in your car. It's gasoline to a car. That's what glucose is to our bodies. So you eat something and the sugar or the glucose is extracted from that food. The pancreas identifies there's carbohydrates, glucose in the system, squeezes out insulin. The insulin goes and picks up the glucose and carries it to the cells. All the cells in all the organs need glucose to function. It's their energy. In people that have type 2 diabetes, that insulin transportation mechanism is becoming ineffective, or the insulin is not working as well. So the pancreas starts producing more insulin. Well, eventually over time, the pancreas can't keep up. And that's called insulin resistance. And people who have too much glucose in their body, there's nowhere else to store it.
So then what happens is that the glucose then gets converted into fat and is stored in the body as excess fat or adipose tissue. This leads to weight gain. And if you've listened to any of the previous videos, you understand that this also contributes to increased risk for some of the other chronic diseases. specifically overweight and obesity, hypercholesterolemia, hypertension. And then as the weight increases, the level of type 2 diabetes goes up. So, in the next series, let's talk about what are some risk factors of patients developing type 2 diabetes.